I really appreciate you joining us today, Dr. Watson. How's everything going again?
Everything is good. I can't complain.
Great, great. So I'm going to start this off by just asking a simple question about your background. How long have you been a scientist, and when did you first become interested in medical research?
So I've been in the science field since about 2002. I have a master's of science in basic medical research that I got from Wayne State University School of Medicine, and I have a MPH from UIC and a doctorate in health science from Nova Southeastern. And I've been in, like I said, I've been in the science field since around 2000, shortly after I graduated from undergrad and graduate school. And what got me interested in it actually was my personal experiences. Unfortunately, I learned about health disparities and specifically cancer disparities at a young age. My biological birth mother was diagnosed with breast cancer when I was 6 years old. Ended up dying from breast cancer, later on that year, when I was in first grade. And so when you're a first grader exposed to a mother dying from breast cancer, that kind of changes your whole world and really makes you understand the fragility of life a little differently. Although that's not how I phrased it when I was 6 years old, I knew I wanted to do something about it. And I just always had this fascination and passion with science from, junior high science experiments. I still remember the science experiment I did when I was in junior high to, anatomy class in high school. And that's why I always tell people it's so important that when you see a young person, particularly a young Black man who's interested in science or anything, that you do everything in your power to cultivate his interest.
Yeah, that's a very good point. I can definitely relate to that. My father had hypertension and kidney failure and passed away when I was quite young as well. So that's why this story was very important to me and speaking with you as well.
But thank you for that.
Absolutely. I know you have an extensive background in cancer research and treatment and prevention. And you briefly touched on this a little earlier, but can you talk about what are the most common forms of cancer that you see in the Black communities amongst both men and women?
So we have all of them. We have lung cancer disparities, colorectal cancer disparities in men, lung in men and women, colorectal in men and women, breast in women, prostate in men. But another one that's creeping up that we're not talking a lot about is also head and neck cancers, from tobacco use, high alcohol use, but then also from the stress in our neighborhood. A colleague and I are doing some research looking at this concept called structural violence, meaning what are you exposed to in your neighborhood? Not just that interpersonal violence, not just that violence between two people, or that gun violence or knife violence or something like that. No, we're looking deeper. We're looking at structural violence. Structural violence is actually living in a neighborhood where you're constantly hearing sirens. And those sirens keep you elevated at a stress level where instead of, and your cortisol levels and stress hormones are always elevated. That's structural violence. Structural violence is the food insecurity, food deserts you talked about earlier. That's structural violence. Redlining is the structural violence, right? Being discriminated with on your job, being Black in America is an element sometimes of structural violence. Police profiling, structural violence. All these things put you on edge. And when we say on edge, that's what we say. But really, your body is at a heightened physiological state. And that's causing your arteries to harden. It's causing your heart rates to be elevated. It's causing your blood pressure to be elevated. It's causing certain sugars to be elevated. All these things can lead to poor health outcomes. And we know that that's the same with a lot of cancers, particularly in things like lung cancer, breast cancer, head and neck, and prostate cancer.
Wow. I've never heard of head and neck cancer before today. So that's definitely something I have to do my research on for sure.
And that's why I love working with some dentists. I work with a Black dentist. His name is Dr. Patrick Smith. Shout out to Dr. Smith. I love working with Dr. Smith because one, he's a brother that went to Morehouse, then went to Harvard for dental school. But I also love the fact that he educates his clients, his patients, not on just oral health, but also on cancer prevention, having those types of conversations.
I want to ask you, you kind of briefly touched on this with the pandemic. How were pre-existing factors exacerbated through the pandemic in our neighborhoods and pushed further along because of those circumstances?
Yeah, no, that's a great question because when I did a lot of community town halls about the pandemic when it first came out about the importance of testing. Now I'm doing these similar town halls about the importance of the vaccine. But early on, one of the questions I got was, it was kind of rooted in conspiracy theory a little bit, right? When they started seeing that more Blacks were dying from COVID-19. Like I remember doing some work. One of our clinics is in South Shore, and the zip code 60649 was, and unfortunately still is, one of the highest mortality zip codes, meaning the zip code with the highest death rate from COVID-19. And so people were saying, well, Karreim, are they targeting the Black community? You know, it's COVID. And I said, it's not that COVID as a virus seeks out Black people. It's not that it was man-made to kill Black people, because it's taking us all out, right? What happened though early on in the pandemic is that COVID-19 is a respiratory, it's spread through droplets. It's spread through droplets in the air, through spit, it's a virus that's very contagious, right? So if you're in close quarters, you're more likely to get it. So if you live in a 1-bedroom apartment and it's 5 of y'all in there, or if you live in a 2-bedroom apartment and it's 6 of y'all in there, and y'all just trying to make ends meet, it's probably very difficult for you to social distance, right? You live in a senior care building. It's only maybe 2 elevators and maybe one of them only working, right? So you get on that elevator and next thing you know, you're in a confined space with somebody. You couple that tight quarters that many people in urban areas live with, couple that with things like hypertension, high blood pressure, diabetes, respiratory issues, being overweight, all those things were what we called a perfect formula for a bad outcome.
Wow. I guess from there, how do we move forward, and what are some things that we can do in the Black community and on the West Side to live happier, healthier lives?
And one of the things you can do is have more forums like this. You know, I do some work with barbershops, and I think we need to, one of the things I say is that people shouldn't have to come get health information. Health information should go and find people, right? So we should be taking the word to the streets. We should be just the same thing we do with voter registration, everything else, doing a foot movement. We should be doing a foot movement for health outcomes. You know, I know a lot of people are on the fence about whether they should or should not get vaccinated. And I believe that people should have the right to choose and make an informed decision. But unfortunately, a lot of people that are not getting vaccinated right now are making that decision based on myths and not facts. So one of the things I hope we can do more of is have conversations like this, because you got to make health accessible to people. You got to make it affordable, accessible, and you got to remove the stigma that I'm going to find out something that's going to kill me. Right? Or I talk to a lot of people and they're like, Karreim, I don't want to find out one other thing that's wrong with me as a person. I got this, we more likely to have this, I'm more likely to die from this. I don't want to find out. So we got to make health more about prevention and early detection than it is about treatment.
For sure. And I guess my last question, if it's okay with you, is there any advice or tips, recommendation you'd give to anybody that's a little hesitant about getting the COVID vaccine?
Yeah, do your research. Go online to the CDC. I know some people still are leery about big government, but being curious and being skeptical shouldn't prevent you from getting all the facts and finding out what information is. Talk to your primary care doctor. If you don't have a primary care doctor, get one. I tell everybody the best thing you can do is to get a doctor that you see at least once a year who knows everything about you. They know your family history, they know your social history, they know what you did last night and what you should have done, right? So they can ask you the right questions. So get a primary care doctor. That's one. And then you talk to that primary care doctor about, you know, is the vaccine safe for you?
Perfect. Well, I want to thank you for your time today, Dr. Watson. I really appreciate it. Hopefully we can speak to you again in the future.
I'm here. You all give me a call and I'm right there.
Absolutely. Thank you so much. This is Dwan Robinson. Absolutely. You too. This is Dwan Robinson reporting from Storyline Studios. Thank you.